Hi, I'm Dr. Sam Dubé. I'm here to talk to you today about hammer, claw, and mallet toes, their symptoms, the underlying causes, and the benefits of different treatment options. The symptoms of these conditions are toes that appear curled under to varying degrees. Hammer, claw, and mallet toes are variations of deviant toe malformation that are neither genetic nor trauma-based. The toes appear curled under to varying degrees. What causes these conditions? Well, hammer, claw, and mallet toes are usually caused by an imbalance of the flexor and extensor muscles of the relevant joints, especially when one muscle group overpowers the other. This often happens when unhealthy footwear is worn for extended periods. Let me explain. There are two muscle groups that control joint movements: flexors, that cause the toes to bend downward, and extensors, causing the toes to rise. These two muscle groups naturally oppose each other, and when they work together, they produce a balanced tension that keeps the joints properly aligned. These two muscle groups are subdivided into two muscle types. Intrinsic muscles, those are the small muscles in the foot. These muscles are involved in finer movements. And the extrinsic muscles, muscles in the lower leg that are connected to the foot via long tendons. These muscles help stabilize the feet during weight-bearing activities. The Y is a random result of intrinsic muscle activity attempting to create a proper functioning arch when the foot's extrinsic muscles have failed to do so. For proper function, our feet require the right stimulus and the right movement. Right stimulus consists of the subtle varied stimulus that the soles of our feet receive when we walk, especially when we walk on barefoot or natural terrain. With each step, there are subtly different sensations. These subtle differences in stimulus keep our brain on high alert so that our body's protective reflexes function properly with optimum muscle function. When our brain is uncertain about what will happen, it triggers protective reflex muscles activations that support our arches before our feet contact the ground, to ensure that our feet and legs can safely manage the forces generated by our bodies relative to the activity intensities. As activity-related stimulus intensifies, a progressively higher arch is created. That's why, when they're functioning properly, our arches and toes rise and fall dynamically in response to the varying activity stimulus intensities. This uninhibited dynamic movement is right movement. Right stimulus and right movement prevent the imbalanced muscle function that contributes to the formation of hammer, claw, and mallet toes. Conventional footwear impairs optimal foot function in two ways. First, most conventional footwear dampens right stimulus. This is particularly true for shoes or insoles that support or cushion our feet. They spread the forces evenly across the soles of our feet, creating sensory input that's muted and repetitive, step after step. Within a short period of time, our brain tunes out the stimulus and just stops responding to it. As a result, our brain doesn't sufficiently activate the muscles that stabilize our arches and properly align our feet, legs, hips, and lower back before our feet contact the ground. This tuned out brain response is actually natural and happens all the time. The same thing happens when we walk into a room and first smell the coffee or the bacon, and then after a few minutes, we don't notice those smells at all. Second, most conventional footwear, especially footwear that's tightly laced, has snug toe boxes or stiff midsoles or outsoles, restricting the right movement dynamic raising of the arches and toes that's so critical in the creation of a strong, stable arch system and the healthy linear propulsion with the toe-off forces spread across the forefoot. In many cases, when right stimulus and right movement are impeded, our intrinsic muscles may attempt to stabilize our arches when our feet hit the ground. This is a function they are not capable of performing, leaving them vulnerable to inappropriate activity. This can lead to an imbalance in specific muscles and lead to the formation of hammer, claw, and mallet toes. Conventional treatment for hammer, claw, and mallet toes include the following: taping, supportive products such as orthotics, toe separators, and surgery. While these methods may temporarily alleviate symptoms, they don't address the poor neuromuscular function that is the cause of the problem. In fact, the more we artificially support or cushion our feet, the weaker and the more dependent we become on these types of products. Now, these old school support and cushioning treatment methods are not recommended in any other area of musculoskeletal medicine as a viable long-term treatment option. In fact, today's modern treatment methods for poor neuromuscular function focus on increasing mobility, muscle strength, and proper alignment via proper technique exercise, which requires both right stimulus and right movement. Science has shown that simply challenging the body to do its job is the best way to restore and enhance function. This principle is the foundation for virtually all of today's sports training and rehabilitation programs. To address the poor neuromuscular function that causes hammer, claw, and mallet toes and prevent them from recurring, I recommend the following: walking barefoot on natural terrain as much as possible. This provides the optimal right stimulus and allows for the right movement required for healthy neuromuscular function. To obtain right stimulus in your conventional footwear, use BioPods stim soles. For best results in conventional footwear, use BioPods stim soles in loosely laced, soft, flexible footwear that allows your arches and toes to rise easily. For optimal neuromuscular function while wearing shoes, use BioPods Footwear, which are specifically designed to provide the right stimulus and facilitate the right movement that optimize and encourage healthy foot, leg, hip, and back function. Don't forget to consult with your healthcare practitioner and ask them about employing soft tissue mobilization therapies to address the fibrotic scar tissue that may have formed in the past.